Thank you for that introduction and welcome to this webinar titled The Role of Leadership in OHS Auditing. My name is Daniel McConville and I'll be presenting this webinar, The Role of Leadership in OHS Auditing. However, before we start, let me just tell you a little bit about myself, what I do as my day job and why this topic is so important to me. As you can see from that slide, I have over 35 years experience in both health and safety and food safety, and a lot of that experience is in the field of auditing. So I run a health and safety and food safety consultancy business based in Melbourne, and primarily what we do is we work with businesses to help improve their health and safety record, reduce injuries, reduce work cover premiums, and we also develop health and safety and both food safety systems. So we do a lot of things like gap analysis, do a lot of auditing, inspections, risk assessments, food safety auditing, and as I said, we also develop health and safety management systems. But I would just like to start with a couple of quotes. The first one there, effective management without effective leadership is like straightening the deck chairs on the Titanic. And that comes from Stephen Covey's The 7 Habits of Highly Effective People. The second one there from Edgar Schein, leaders create and change cultures, while managers and administrators live within them. I started with that top quote from Stephen Covey because what it is saying is that whilst you can have the best systems in the world, if you don't have effective leadership, then those systems won't function efficiently and effectively, and you won't achieve your intended outcomes. Senior managers often see auditing as a means of providing themselves with the assurances that things are as they should be. The trouble is, if leaders are seeking such assurances, then that's exactly what they're going to be given. Part of the reason why I've chosen this topic is that when I have been auditing, I've witnessed a distinct lack of leadership in the process from the organisations being audited. And this is demonstrated by the management of the health and safety management system or the food safety program, whatever is being audited. A number of times it's been pushed down to a middle manager or a supervisor only weeks or a week before the audit, and this person is then expected to run with it. I'll speak about that a little later in the presentation. However, in my opinion, this is one of the key failings in the audit process. So what will I be covering in this webinar? I will look at what leadership is. I'll talk about leadership and commitment and then go into why leadership is crucial in health and safety auditing. And I'll finish off with looking at what good leadership looks like. But first of all, this diagram here, the Plan, Do, Check, Act diagram, and that's come straight out of the ISO 45001 OHS standard for OHS management systems. As you can see from that slide, right in the middle of that diagram is leadership and worker participation. And it is crucial that we do get leadership and we do get worker participation in this process. And whilst planning, support and operation, performance evaluation and improvement are all important components, leadership and worker participation are integral to its success. The PDCA concept is an iterative process and it's used by organisations to achieve continual improvement. And it can be applied to management system and to each of its individual elements. And just to go through each one of those, the first one is plan. So we have planning in that one, and that is to determine and assess our health and safety risks. Look at our health and safety opportunities, and then look at any other risks and other opportunities. And it's in this part where we need to establish our objectives and also our processes that are going to be necessary to deliver the results in accordance with what we have established in our health and safety policy. The next one, which is the do, and that's where we talk about support and operation, and this again is fairly simple. It is just implementing the process as we have planned it. Check. So this is the third one, and this is where we monitor and measure the activity. So we look at our performance and evaluate our performance with regards to health and safety. So we need to measure our activities and processes, and then we need to measure those against our objectives, and then we report the results. And the last one there, act. So that's the improvement. So this is where we take actions to continually improve the health and safety performance and to achieve the intended outcomes. So without the PDCA cycle, then the rest of the system is difficult to implement and manage, and this is why it sits right at the front of the ISO 45001 standard. Okay, so let's get into leadership and let's have a look at leadership. And I just want to start here with a couple of definitions over the next two slides, and these will be on leadership, on top management, and also our definition on audits. The first definition there, leadership is the process of influencing the activities of an organised group towards goal achievement. And along with the Edgar Schein definition at the start of this webinar, I found this to be one of the better definitions on leadership that I have read. And what it is saying is that the role of a leader is to influence others. So you're influencing your work group, your team, your workers to achieve certain goals. It doesn't define leadership to a certain level of personnel within the organisation, and that means that leadership is open to all workers within the organisation. So that's from the board to senior executives down to middle managers, site managers, frontline supervisors, and to workers. So leadership doesn't have a rank. Therefore, anyone can be a leader. And leaders are people who influence the attitudes and behaviours of others. And sometimes they will do this through their formal role, and sometimes by their personal influence or their personal attributes. So leaders are the ones who create the culture by what they pay attention to and how they do things, what they measure and how they measure along with what they control. Good leaders will demonstrate this by leading by example and demonstrating the right practices. So the definition there of top management, I've taken that again straight from the ISO 45001 standard. And it is a person or group of people who direct and control organisations at the highest level. So who is top management? Top management generally is going to be the very highest person within that organisation. However, having said that, you may have top management at different levels of the business or departments. So it is important that all management demonstrate a positive leadership style when following the health and safety management system. A positive leadership and management style can improve the organisation's safety performance. And again, there is strong evidence that performance is improved when organisations address health and safety risks along with other important business risks. So if we look now at the next definition, and this is the definition of an audit. And it's a management tool used to examine processes and activities and gauge whether they are conforming to standards and procedures and whether there are any opportunities for improvement. Now, I took this definition of an audit from the Safety Science Journal in 2001, and it was taken from an article written by Werner Blewett and Valerie O'Keefe, and it was called Weighing the Pig Never Made It Heavier, Auditing OHS Social Auditing as Verification of Process in Australia. And what I like about this definition is that it relates to processes and activities and not just procedures. Most definitions are procedural based, and that doesn't necessarily mean that the activities surrounding those procedures are being followed or understood. But with this definition, it leaves it open to who conducts the audit. So however, whether that is an external or internal body undertaking the audit, there is still a criteria to follow. And I will get to criteria shortly. But just down the bottom of that slide, I've also included there a definition of what is the purpose, and the purpose of an audit is to identify strengths and weaknesses within the safety management systems. So I've included this because in my experience, this is an area where organisations fail to get it right, and therefore they miss receiving valuable information or areas where they can improve, or gaps in the system that could lead to major incidents or injuries in the future. Particularly in OH&S ordering, we need to challenge management to demonstrate that the system is working, and this approach lends itself to providing summary evaluations of how well safety has been managed. As an example of this, it could be in a manufacturing workplace where noise controls such as baffles or dampeners or something along those lines has been installed to reduce noise levels. But challenging the system that it works, so what is the assurance that those controls work? What evidence is provided? So do we calibrate or do we test results? Has that been provided? How do we demonstrate that the system is working? So these are the types of strengths and weaknesses we need to identify in the management system. Okay, so let's now have a look at leadership and commitment. And I spoke earlier about leadership and commitment and how it has its own section within the new ISO 45001 standard. Whilst I haven't included every point in the presentation, I have focused on 4, and these are the 4 that I believe are more relevant to this presentation. The first point there is taking overall responsibility and accountability for the prevention of work-related injury and ill health, as well as the provision of safety and healthy workplaces and activities. So responsibility for this point sits with top management, in my opinion. Accountability is about top management encouraging workers to participate in the management of the operation of the health and safety management system. Responsibility can be passed on to others. It can be delegated to others. However, I'm going to talk about this shortly as one of the reasons why I find that audit results can be sometimes useless, as top management have delegated to others but have not given them the responsibility, the accountability, or the direction. It's okay to delegate responsibility, but if you do this, you need to ensure that the workers have been given some information and instruction on how this task needs to be carried out, how this task needs to happen. Don't just hand it over and think that they'll work it out for themselves. The second point there, ensuring the integration of the health and safety management system requirements into the organisation's business processes. And I've chosen this one simply because whatever your health and safety requirements are, they need to be integrated into your business. It's not a case of doing everything and then saying, oh, we need to do all this safety stuff now. It shouldn't be tacked on to your business. It needs to be integrated into your business. And this is where, when you're developing your health and safety management system, you should be consulting with the relevant personnel to ensure that the system is integrated into your business, that it's not just some sort of add-on, that it is actually integrated into the business. The third point there is developing, leading and promoting a culture in the organisation that supports the intended outcomes of the OH&S management system. This is important because top management needs to ensure that the culture of the organisation is such that we not only support the OH&S management system, but we also support why it is integrated into our business and also support the outcomes. So, as I said before about management or about leadership, they define the culture of the organisation. So they need to ensure that they are promoting the right culture into the organisation so that we do get our intended outcomes. And the last point there that I've raised is directing and supporting persons to contribute to the effectiveness of the OH&S management system. Again, if you're delegating down, this is where top management need to ensure that there are resources available to manage the health and safety management system, but they also need to support those who are charged with managing that health and safety management system. So don't just delegate it down. You need to make sure that you are, not only if you are going to delegate, then you provide that person or that team of people with the right resources, and you give them the support to be able to manage that health and safety management system. Okay, let's have a look now at the role of leadership in health and safety auditing. Okay, so now that I've gone through and covered leadership and what it is, I would just like to turn our attention to why I believe it is crucial in health and safety auditing, and why some audit results are less than favourable due to poor leadership. But before I do this, I'd just like to refer back to the ISO 45001 standard, and just under the introduction section there is a section on success factors. And I just want to highlight the top two success factors there. And it's by no means an accident that leadership is mentioned in the first 2 points when talking about the key factors required to help you achieve your intended outcomes. And in most cases, your intended outcomes are going to be the implementation, the maintenance, and the effectiveness of your health and safety management system. And those top 2 points in this section for achieving the intended outcomes are top management leadership, commitment, responsibility, and accountability. And the second one, top management developing, leading, and promoting a culture in the organisation that supports the intended outcomes of the OH&S management system. And as I said, it's by no means an accident that these top 2 points have leadership in them. And top management need to demonstrate this, and I'll talk about commitment, responsibilities and accountabilities later on, but we also need to ensure that we are developing, leading and promoting the right culture within the organisation. Okay, so the 3 key areas where I see a lack of leadership in OH&S auditing are: the audit is pushed down to someone within the organisation to manage, and that brings with it a lack of worker participation. The second key area, the criteria becomes too big, or there is confusion about the audit criteria and what should be in it. And the third one that I will talk about is that most organisations only want the good news stories. They don't want to hear the bad news. So what I will do is I will go through each of these key points, and I'll explain the role that leadership plays in ensuring an effective outcome when auditing. So the first one there is lack of worker participation. And 2 points that I want to highlight here. The first one is that the audit is pushed down to someone within the organisation to manage. When I conduct health and safety audits, I'll always meet with senior management prior to the audit. And often on the day of the audit or the day before the audit, when talking with senior management, you'll be told that, well, someone else is running with the audit, or I'm too busy today, there's too many deadlines, so I've delegated this responsibility to someone else. Uncontrolled events such as these will happen within your organisation, and a lot of times they can't be helped. However, it's the delegation of responsibility during these uncontrolled events that is crucial. To explain this statement a little better, or clarify it a little bit, if the organisation or your organisation was going through a financial audit and on the day the manager was unavailable, then they wouldn't delegate that responsibility to the HR department, They wouldn't delegate the responsibility to the office graduate to run with. Definitely not. And the reason for that is simple. These people would have little understanding of the requirements of a financial audit. They may not know where the procedures are located, they may not understand the financial jargon, and they would most likely not have a clear understanding of how to demonstrate that the system is working. So, why does this happen when there is a health and safety audit being conducted? Not only does this send the message that the audit's not that important because anyone can do it, the person having been delegated the responsibility may have little understanding of the activities and processes of the various departments. And if you're a broad organisation, if you have a number of different departments, you may have a purchasing department, production, manufacturing, warehousing, logistics. If you have those different departments, then that person being charged with the responsibility of running that audit may have little understanding of how each of those departments work. So a lot of time is wasted trying to find documents or trying to find evidence that in the end some workplaces either don't get covered at all, or if they do get covered, they're skimmed over simply because the auditor has run out of time. And what this means is that the organisation is not getting the right feedback because the areas haven't been covered as thoroughly as they should have been. The other common display of poor leadership with lack of worker participation is through a lack of access to the relevant workers. And that can be difficult because of rostering arrangements, or a lot of the times, though, the relevant workers were not advised that the audit was taking place. If the audit has been planned efficiently, then the rostering arrangements can be taken into consideration when planning walkthroughs or staff input or staff interviews or people that you do want to speak with. And I'll give you an example of this. I was auditing a large waste management organisation, and two months before the audit, myself and the audit team leader met with the senior management to discuss the audit criteria and who we needed to speak with. The objective of the audit was to provide legal advice to the organisation's board and to their executive in respect of their obligations and potential liabilities under OHS laws, but we were looking specifically at the organisation's implementation of its policies and procedures. Management wanted to get as much information from the workers as possible. Therefore, the site managers were advised that schedules and rosters needed to be adjusted so that we could get access to the right people. And yes, it did make some pre-planning, and the site managers did say that it was an absolute nightmare for them trying to organise and coordinate and get the right, or make sure that the right personnel were available. However, the information received from providing access to the right people was absolutely fantastic. So due to this pre-planning and additional work from the senior management team, the objectives of the audit were well and truly achieved. So the message here is quite clear. If you are responsible for organising health and safety audits, or you are the person responsible to ensure that the relevant personnel are aware that an audit is happening, then remember that the strategy of the audit is to challenge management to demonstrate that the system is working. Therefore, we need to ensure that the right personnel are involved in the audit from the start, and they're not brought in at the end as a stopgap measure because someone was too busy to organise it. So here the message, as I said, is clear. We need to ensure that we are planning and pre-planning and making sure that the right people are there or available to the auditor. Okay, if we have a look now at the next slide, and this is defining the criteria. And as the slide there says, get it right before you start. The audit criteria is used as a reference against which conformity is determined, and this could include applicable policies, procedures, standards. There could be laws and various regulations. There may also be management system requirements or contractual requirements. There may even be some industry codes of conduct. So defining the criteria for the audit is critical in ensuring that the expectations are met, and as the slide says, get it right before you start, because once you start, it's too late to change. So why is leadership important and crucial in this step? Too often, the criteria becomes too big, it gets too broad for some organisations, and there's been little planning or consultation gone into how are we going to achieve this criteria. Or, like we saw on the previous slide, we mentioned how it was delegated to a middle manager or someone down the organisational chart to sort out. The message here is the senior management team must be involved in determining the criteria, because without knowing where the goalposts are, you can't provide the adequate resources to ensure that you are ever going to kick that goal. I'll give you an example of that. And this is an example of where an organisation failed to get their intended outcome simply because the senior management team did not get involved and did not sort out the criteria prior to the audit commencing. About 2 years ago, I was asked to audit an organisation's health and safety management system to ensure that it complied with the Australian standard 4801, which was the standard here in Australia for occupational health and safety management systems. The organisation was thinking about getting their system certified to AS 4801. So I spoke with their CEO prior to the audit just to get some background information, and I asked him if their health and safety management system had been developed in line with AS 4801, and also what measuring and monitoring systems did they currently have in place to evaluate their system. I was assured by the CEO that everything was in place. The relevant managers had told him that, yeah, everything's fine, it's all set to go, we're all good to go. So without little consultation, the CEO said, listen, just come and do the audit. Now, under Section 4 of AS 4801 is the title OHS requirements, and this is where it specifies what your requirements are. There are subheadings such as OHS policies, planning, implementation, those sorts of things, and under each one of those, there are also subheadings under subheadings under each one of those clauses. The organisation, whilst they had very good intentions, they did not even have a copy of AS 4801 on site, and their system was lacking in quite a few areas against this standard. I met with the CEO early in the afternoon as it became clear that this organisation was a long way off being certified. I thought it best to deliver the bad news, deliver it early and in person. The CEO was quite surprised by the outcome, and during the discussion I asked him who set the criteria, who wanted the system to be certified to 4801, and why was this so important? What value would this add to the organisation? The CEO advised me that it was he who set the criteria. However, he said it after being advised by his line managers who had told him that getting certified to 4801 was quite a simple process. He passed that information on to the board without verifying it, and the board then thought it would be a great idea. However, no one was really sure what value this would add to the business. So the message here is when setting the criteria, you need to have an understanding of what the criteria is and what resources you are going to need in order to be able to meet that criteria. Okay, let's have a look at the third one here. And that is, most organisations only want to know the bad news. Only want to know the good news stories. They don't want to hear the bad news. And it is human nature to want to be told the good news. Everyone wants to hear good news. Everyone wants to be told that they're doing a good job. And with OHS auditing, some organisations I've dealt with, they only want to hear the good news. They want the bad news to be glossed over, or they'll just tell you, stick it in the report. This way, it's easier not to have to listen to or even act on it. Or even worse, if it's in the report, then it's easy to be hidden from senior management. Professor Andrew Hopkins, who is a well-known international OHS specialist, wrote in his book, Lessons from Longford, one of the findings which emerges from every disaster inquiry is that company auditing provided only good news and failed to identify problems which became very obvious after the event. Hopkins went on to say that it is probable that audits which most effectively transmit bad news to the top of the hierarchy are audits which have abandoned any benchmarking or comparative purpose. So, the mistake made here by organisations is that they believe that getting a non-conformance during an audit is a cause for doom and gloom. They go ahead, they reprimand personnel, and this is where they only want the good news stories. So the message here is that if you get a non-conformance during an audit, or you have an incident, or someone has raised an issue, it shouldn't be a time for doom and gloom. We should actually use that as an opportunity to improve our management system and subsequent activities. This is where leadership is so important. This is where leaders need to stand up. This is where leaders, and by leaders I'm talking about top management and other managers, they need to encourage workers to relay the bad news and the non-conformances. If management are going to continually reprimand workers for getting non-conformances in an OHS audit, then a lot of the bad information is going to be brushed under the carpet, or if they do receive some of the poor information, it is going to be a watered down or sanitised version. The danger with this system is that brushing things under the carpet and only providing management with the information that they want to hear could lead to a more serious incident happening because the right information was not provided. And this has been confirmed in the above quotes from Professor Andrew Hopkins. So as leaders, we need to think of bad news or non-conformances as opportunities to learn and to use them as a form of continuous improvement. So if you're working with managers who don't want to hear the bad news, then you need to remind them that of the audit definition that we went through earlier in the presentation, and that is the audit is a tool used to examine processes and activities and gauge whether they are conforming to standards and procedures and whether there are any opportunities for improvement. We need to view this simply as an opportunity for improvement. So I've spoken about leadership. Now let's have a look at how do we demonstrate good leadership. What does it look like? Now, the demand for health and safety management system auditing suggests that it is going to remain the primary tool for assessment and measurement of our OHS performance, and that's going to happen for some time to come. It is therefore crucial that in order to get the best result for the organisation, or to gauge whether the organisation is conforming to standards and procedures, and whether there are any opportunities for improvement, organisations must demonstrate good leadership throughout the entire auditing process. Without management commitment and leadership to safety, leadership, the safety culture will deteriorate and the injuries will increase, or they're going to be more likely to increase. And if that happens, this is going to have an effect on other things such as morale and also productivity. So management need to show commitment through involvement in day-to-day safety activities and not just pay lip service in order to drive culture change and improvement. So on that note, let's have a look at the first summary point, and that one is about being committed. So we often read and hear that the responsibility for safety starts at the top, and that is so true. So top management need to demonstrate that they are committed, and they can do this by forming a partnership with their workers to achieve a safer workplace. So walk the walk, talk the talk, do all of those things, but organisations need to demonstrate that they're committed. Otherwise, the process of auditing becomes very difficult and outcomes are less likely to be achieved. The second one there, communicate and consult with your workers. And again, there is a lot of research out there that tells us that those organisations who consult with their workers have far better safety outcomes than those who don't. And this can also be true of those organisations who involve their workers in the audit process, achieve their intended outcomes a lot more times than those who don't. By communicating, consulting with your workers, you'll be more likely to get their buy-in to the audit process, and if this happens, then your intended outcomes are more likely to be achieved. The next one on planning. So planning effectively and having the right people. And we've seen this, it's been a theme right through this webinar. And as the saying goes, failing to plan is planning to fail. With regards to auditing, I'm not saying that if you plan, you will succeed. What I am saying, though, is that if you do plan, you are more likely to achieve your intended outcomes. So planning includes ensuring that you have the adequate resources, ensuring that you have consulted and communicated with your workers. You've gone over the criteria, you've reviewed it, and making sure that it's relevant and it is not too broad. And if you are going to delegate your responsibility, then ensure that the person you are delegating to has the right level of competency, experience, and knowledge to do that. The next one, site walkthroughs. Managers need to ensure that information about any safety issues, maintenance issues, incidents, hazards reported, compliance issues, whatever they are finding their way up the management chain to the top, or they are finding their way to the right person. And by this, I don't mean just filling out a hazard report form and dropping it on someone's desk. I find the easiest way to do this is for managers to conduct regular walkthroughs of the shop floor, and this should be done on an informal basis. Now, a lot of organisations will do this on a more structured basis, but I find that if you do it more informally, what you're going to get from your walkthrough is that you're going to give the workers the opportunity to speak with the managers. They'll be able to voice their concerns or raise suggestions for improvement. If management are doing this prior to an audit, and by prior I don't mean just a week before, then a number of issues that could have potentially been raised by the auditor may have already been taken into consideration and changed or improved, or you may have identified something that could have prevented a serious injury from occurring. In addition to this, workers are going to remain involved with safety as their views are sought and acted on. I often hear workers say that they never see senior management in the workplace. So the message here is to get out into the workplace as often as you can and speak with your workers. And that goes into the next point about involving your workers in the process. So similar to communication, organisations need to ensure that they are involving their workers in the process. encourage workers to participate in the process. And if you do have any obstacles to participation, make sure that firstly you identify them and then remove them. Now, a good example of an obstacle could be where language may be a barrier, or literacy might be a barrier. So if we identify those, we need to ensure that we are removing those obstacles. Another area for involving workers is to ensure that we're providing mechanisms for workers to provide input into your safety program. Now, initially, a lot of this is done through a paper-based system, or it's a paper-based mechanism, and if that's what you've got, that's fine, but we need to make sure that that is accessible to workers and they know how to use it. However, what I would encourage you to do is have a look at digital technologies such as tablets and mobile phones. So most workers these days will have access to some sort of smart device. So use these devices to involve your workers in your process. The next one, don't discourage your workers to bring you the bad news. Don't view bad news as everything is terrible. As I've said before, you need to view the bad news, and when we're talking about bad news, they could be non-conformances, they could be hazard reports, incident reports, near misses. We need to view that as an opportunity to learn. So encourage your workers to bring you the bad news, bring you the safety-related issues. This way, the issues can be resolved. What that does is it demonstrates commitment to the program when you are resolving those issues, but it also encourages the workers to get involved in the process because they can see that you are going to do something about it. And the last point there, behave and act as you would expect others to behave and act. And what I mean there is set the standard. The standard that we walk past is the standard we accept. So don't tell your workers to follow a particular standard unless you are going to demonstrate those same qualities yourself. Okay, so just to finish off, a couple of slides here, just in summary. First one is we need to ensure that we are committing to the process. And I've been through that and there's information there on that. But to demonstrate leadership and ensure that we get leadership through the OHS auditing process, we need to make sure that we are committed to that process. We also need to ensure that we encourage our workers to participate and get involved. And I just spoke about that on the previous slide there. So encourage them to get involved, encourage them to participate. Go to your workers and ask them the questions. Ask them what are the issues. And then seek input of your team. So if they come to you with an issue, ask them how to resolve it. Get their opinion, seek their input. Again, this all goes to getting buy-in and getting commitment from your workers. But as the top point there says there, that you also, as the manager, need to be committed to the process, and that is how we demonstrate leadership. And the last point there is influence the attitudes and behaviours of others through your actions. So again, you set the culture, you set the standard that you want your workers to follow. Now, I just want to finish off with this slide here. And again, this is another one that has come out of Professor Andrew Hopkins' book. And it says there that management actions and actual day-to-day behaviour are generally much more important than simply changing written policies and procedures for effecting lasting cultural change. For senior managers, actions speak louder than words. If senior management only changes what it says rather than what it does, then little progress is going to be made. And that's why we need to demonstrate effective leadership throughout the OHS auditing process. We need to be the ones that are effecting lasting cultural change. So just to finish off, again, I would like to thank you for listening to this webinar. That slide there just gives you a little bit of information about myself, some contact details there. So if there is anything that clarification that you would like, or want to just seek some further information, I have my both email and web details there, so feel free to contact me there. So thank you for your time, and I hope that you've certainly got something out of this webinar. And just the last slide there were the references that I used. As I said, there's a lot of information come out of this through people who are experts in leadership. So again, thank you for your time. Thank you. Thank you. Yep. All right, no worries. Okay, great. Thanks for that. Thanks. Bye.